when you guys are done admitting everyone, then give me a signal so we can start.
We're live on Facebook.
Mm-hmm.
I have a sign.
Yelena?
Yes.
Oh, there you are. Hi.
Hi. I think we're live on Facebook. Should we start already?
Yes, we should start, but we need to ask everyone to mute their microphones and cameras and turn off their cameras, except for the panelists, please.
Okay. Hello, everyone. Thank you for taking time to join us today. For those of you who don't know me, I'm Yelena Bisharian, Director of Business Development at Harvard University, also a member of the Board of Directors of City of Smile Foundation, which is currently the largest cancer charity in Armenia. February 15th is International Childhood Cancer Day, which is a global collaborative campaign to raise awareness about childhood cancer and to express support for children and adolescents with cancer. According to World Health Organization, childhood cancer survival rate is about 80% in developed countries versus 20% in lower middle income countries. And we're here today to discuss accomplishments in recent years, as well as current challenges in pediatric cancer field in Armenia. I'm joined by a number of colleagues here today. Professor Tamamian, who is the head of Pediatric Cancer and Blood Disorders Center of Armenia, and the chairman of the Department of Pediatric Oncology and Hematology of Yerevan State Medical University. He is a co-founder of the Armenian Association of Hematology and Oncology, the Professional Union of Hematologists and Oncologists, and co-founder and board member of the largest cancer charity in Armenia, City of Smile Foundation. Professor Tamamian is an internationally recognized expert and scholar in cancer field. He holds MD, PhD, and Doctor of Regulatory Sciences degrees. Georg, this is.
Yelena, you're on mute.
Oh, okay. Can you hear me now? Okay, I don't know what happened. So master's from University of Ulm, Germany, where he currently also lectures pediatric oncology. He completed his postdoc in leukemia at the University of Texas at MD Anderson Center. And in addition to all of this, Dr. Tamamian completed numerous programs in leading universities all around the world, including Harvard Medical School and Harvard School of Public Health. Our next guest is Professor Shant Shekerdimian. Shant Shekerdimian is an associate professor of pediatric surgery at UCLA. He's actively involved in various initiatives in Armenia healthcare sector, including efforts to improve postgraduate medical education, introduce quality improvement programs in pediatric hospitals, and develop multidisciplinary care teams. Professor Shekerdimian serves as an advisor to Republic of Armenia's Minister of Health and is currently a Fulbright scholar researching the feasibility of cancer screening programs in Armenia. Our next guest is Esther Demirchan, who is the Executive Director of City of Smile Foundation. Coming from private sector, She has joined the foundation in summer of 2018. Since then, Esther has become an active advocate of pediatric cancer care in Armenia. She makes all the effort and is quite truly inspiring, and she ensures that children with cancer in Armenia get access to best available treatment, care, and services. Thank you for all that you do, Esther. Next guest is Gohar Geramian. Gohar is a City of Smile Foundation's beneficiary. Currently, she's a first-year student in the American University of Armenia and dreams of becoming an ambassador of Armenia to a foreign country. Good luck. I'll watch your path, Gohar. In February 2020, Gohar was diagnosed with Hodgkin's lymphoma stage 4. During the year of 2020, she has received 6 rounds of chemotherapy and 35 sessions of radiation therapy. She has completed her treatment in 2021 and is cancer-free now. So with this, I would like to start our discussion by referencing Professor Tamamian's article published in American Societies of Journal of Clinical Oncology in May of 2020. In the publication, Dr. Tamamian, you report significant improvements in the current state of pediatric oncology. Could you please summarize findings and tell us about the recent achievement in this sector in Armenia?
Thank you very much, Yelena. Thanks a lot for the kind introduction and for giving the opportunity to talk at this important event. So, as it was mentioned during your speech, majority of kids in higher income countries, they survive. Like we are talking about 80% of kids and more. And in low and middle income countries, the number is around 20% according to the WHO statistics. Of course, in some countries it can go up to the 60% or so. Armenia is a low and middle income country, but when we are talking about pediatric oncology and hematology, our survival curves shows numbers comparable to the high income countries. And I can state that currently the survival rate for pediatric cancer in Armenia is close to 75%, and for some cases it can rise up to the 80% or more. So as you may see, for pediatric cancer, we are close to the developed world. The article which you mentioned, actually the abstract, the full article is in preparation. It's prepared by one of our fellows, by Satyan Hovanesyan, and it was published at the ASCO, American Society of Clinical Oncology annual meeting. So several years ago, when Satyan was an intern, and we worked at that time, we worked at Muratan University Hospital. She was an intern at the AUA, and she did her internship at our clinic. So she did a qualitative study. And last year, she did a follow-up study at our new center, which was established in 2019 as a result of merging all existing facilities in Armenia and in pediatric oncology and hematology. And on the basis of hematology center, we had the Pediatric Cancer and Blood Disorders Center of Armenia. So the follow-up study at this newly formed center showed significant improvements. I'll start about the improvements, just briefly talking about this merging. I think this was a very important and strategic step because it was not just technically merging all the facilities, but we merged our capabilities. And for a country with a 3 million population and with 80 to 100 pediatric cancer cases per year, I think it was a very important decision to have these facilities in one place. And as many people know, in 2016, Hematology Center was reconstructed. So we chose this facility to be part of. And another significant improvement which I'd like to mention is the establishment of the Department of Pediatric Oncology and Hematology, and with respective fellowship program at the Yerevan State Medical University in July 2019, which allowed us for the first time in the history of Armenia to prepare specialists with unified pediatric oncology, hematologist oncology specialization. And before that, we had Armenia had a big shortage of pediatric hem-onc specialists, but with this establishment, I think a lot of questions became solved. I should mention that only in the first year, I mean, we are in the second year. Sorry, we're second year. Right now, we have 10 fellows in pediatric oncology and hematology. Those are best students at the university. 9 of them are from Armenia, 1 is from Russia, and these are really the best ones. And they decided to choose our profession. 10 new fellows in pediatric oncology, hematology. I would compare, for our small field, I would compare if, let's say, 1,000 physicians, 1,000 fellows join gynecology or surgery. So it's a huge achievement for Armenia, a huge achievement for Armenia. For the fellowship program, we made mandatory to have a research component. So every fellow involved in the research, in the fellowship program, clinical fellowship program, must conduct a research. And they do so. Besides being active clinicians, they do active research. And another mandatory requirement is the knowledge of languages, foreign languages. So we require them to know English and Russian languages. Of course, if they know more languages, it's much appreciated. And to be frank, some of our fellows know more languages. Someone told me that she knows Korean even. So I think we are quite multilingual. And our program was adapted from the program of the American Board of Pediatrics and the programs from St. Jude and Harvard. Besides that, during the fellowship program, we adapted also within the department at the university. We also established fellowship programs for transfusion medicine, and now with Sean Shakerdemian, a good friend of mine, we are, and with the help from UCLA, we are doing some project for transfusion medicine development in Armenia, and also we have a department for adult hematology, and we adopted a Johns Hopkins program for this. The other achievement is the joining of St. Jude Global Alliance. Many of you may know that St. Jude Children's Research Hospital, located in Memphis, Tennessee, is the one of the leading pediatric cancer centers in the world. And in 2019, Armenia was the first country to join the Global Alliance established by St. Jude. And we are one of the most active, I should state that we are one of the most active members of St. Jude Alliance. And with some programs, we are really going quite fast. For example, registry project, St. Jude Global Registry, and we are already there, and we are filling this St. Jude Global Registry and putting all our data over there. We also signed an agreement. Yeah.
Go ahead. Go ahead.
Yeah. Also in 2020, we signed an agreement with Rogachev Center in Moscow, which is the leading pediatric cancer center in Russia. Of course, with those centers, both with Rogachev and St. Jude, we have a long-term relationships and long-term programs. But these were formalizations and of these projects, and with this we are going much farther. Then, with the help from the City of Smile Foundation, of course, Esther will talk about it in more details. Right now, every child in Armenia is covered for diagnosis, treatment, care, meals, everything. For a long time, kids were I think from the beginning of 90s, foundations were critical in helping kids with cancer to be able to provide appropriate care. I mean, in the early 90s, it was the Heal for Armenia Foundation in Germany. And then we had local foundations starting from 2000, including OCNEM, Give a Life, Bridge of Health, Fund 100, and recent years, City of Smile holds the the largest amount of the help to the kids of cancer. Esther will give you more numbers on this. Then, with the help from City of Smile Foundation, we established working groups. This was a critical decision, and for several tumor subtypes, including leukemia, lymphoma, and solid tumors, musculoskeletal tumors, and neuro-oncology, and with the involvement of experts from the leading hospitals, we started doing these working groups, adapting treatment guidelines, and for now, we have treatment guidelines for 20 diseases. This is huge work for Armenia, I would say, and the workload is around 5,000 pages, just to imagine. And during these working group discussions, which are held every week, we discuss every patient in Armenia. So every patient in Armenia with cancer diagnosis, every kid in Armenia with cancer diagnosis is discussed in a multidisciplinary setting and with the involvement of world-leading experts. When we are establishing these working groups, we were thinking to just give expertise to different physicians, but then Shant was in Armenia at that time, and he advised, don't go that way, just establish for the subgroups of cancers. And this was a very wise advice, and I think this was really critical for the success of working groups. I should mention also that palliative care clinic, which is going to open soon, and support, which is constructed by the City of Smile Foundation, is going to be the first palliative care clinic for kids with cancer in Armenia. We recently published a chapter about the palliative care situation in Armenia for cancer patients, and it's really, really terrible and dramatic. And I think this is going to solve a lot of problems. To make brief, I would like to mention also that there is a lot of research going on at the clinic, which is really important for the physicians to be updated. Only in 1 year, our fellows and physicians submitted 35 abstracts to the international congresses, oncology congresses, and all of them were accepted for the presentation. We had, with the support from the Bridge of Health Foundation, we started collecting data for 25 years. And all these records are now, we are putting in the St. Jude Global Registry, and hopefully soon we will have this data coming. We started doing high-dose methotrexate, which was not available in the past, and so patients do not go abroad for receiving this kind of medication, and receiving the regimens, treatment regimens fully. Our transplant program, the first transplant was done at the hematology center in 2016 to adult patients, but the pediatric program started going from 2018 when we did the first transplant for neuroblastoma patient, and currently we have already 11 transplants done, and it's ongoing, and we are planning to do allogeneic transplant soon in June, and it's an international program with the involvement of Italian and German colleagues. Our doctors and nurses are getting trainings and fellowships at the world-leading universities and hospitals. Right now, one of our fellows is at IAR, International Agency for Cancer Research, doing postdoc. Another fellow is going to go to Italy. Another fellow completed fellowship in India for the transplant. Our doctors had opportunity to study at several of our doctors completed postgraduate year programs at Harvard, at MD Anderson, St. Jude, and in leading centers in Europe, Russia, and Asia. and our nurses also, this was a problematic part, and we specifically paid attention to nursing education. Last year we had a group, a year before we had a group coming from AUB, American University of Beirut, who trained our nurses, and it was the results were fantastic, because before the training the results were not so good, so majority did not pass their tests. But after a week of training, every nurse, each of those nurses passed the training with excellent mark, with more than 90% result. So I think I tried to summarize some of our achievements. This is a result of teamwork, the dedication of the team, and of course, this is a result of support from our great foundations, individuals, friends, society, and everyone, I think, is a contributor in our fight.
Thank you for a great summary. And, the improvement that you described are very encouraging and exciting. What do you think is the major contributing factor? You just mentioned a few, but I just want to focus our attention to the major contributing factor for this positive change, and what can be done to make it more sustainable?
People. This means team who are working on the ground, medical staff, physicians, nurses, psychologists, social workers, then people at the foundations, individuals, people who want to make a change, who want to help. Everyone, experts, international experts, our friends from different hospitals, everyone. And of course, the wish to make a change. So in my opinion, the contributing factors.
Thank you. My next question would be for Dr. Shakerdemian. Shant, as a surgeon who has trained and now works in the US, what are your overall impressions of the state of pediatric oncology care in Armenia?
Thanks, Yelena, for organizing this conference and for the question. Thanks, Gevorg, for making it easy for me to answer the question by highlighting all of the successes. The state of pediatric oncology in Armenia. So I think it would be useful to think about healthcare in Armenia by sort of the micro level, which is the providers on the ground, the doctors and the nurses. What is the state of providers and hospitals? And then take it one notch up. What is the state of a sector? And in this case, pediatric oncology is the sector. And then, of course, the macro level is the state of healthcare overall in Armenia. So I think we all know that on the micro level, we have some incredible colleagues in Armenia. We have some very talented and gifted physicians, nurses, and other providers in Armenia. And then when we get to that sector level, I think the understanding and what many of us feel is that we have pockets of excellence, islands of excellence. And for example, cardiothoracic surgery, thanks to the efforts of Dr. Hovagimian several decades ago is one such pocket. Orthopedic surgery could be considered another one. And as far as I'm concerned, I think based on all of the assessments and presentation that Gevorg made, it's without any doubt that pediatric oncology has become one of these islands or pockets of excellence. And it's done so not only because it provides the care and there is the hospital there with all of the equipment necessary and medications necessary to treat these patients, as well as the talented physicians and nurses and the rest of the team, but because it's taken the next level and it's brought oncology to the standard of care, or it has brought the innovation and the changes to the practice that we are familiar in seeing here, at least in the United States. And I think that's the case for the rest of Europe and North America and quote unquote developed world. And those are the things that Gevorg talked about, what makes the excellence. Everything that we think about in terms of good care is actually only the minimum. A good doctor, a good hospital, the medications that are necessary. But what drives the excellence is everything else that Georg talked about. And those are the things like having multidisciplinary teams, having international colleagues and collaborators, having a research component, and having an excellent training program that goes along with your clinical care, because we know that good training programs actually improve care for the patients as well. And so I think, again, just going back to what Georg presented, I think that that sort of proves the fact that pediatric oncology is really one of these pockets or islands of excellence within healthcare in Armenia. And that just makes it all the more easier for us to collaborate and to have a working relationship in that field, because we now feel like we are having a relationship with contemporaries or with colleagues that we can talk to about not only the clinical questions, but how to build these teams, how to do better teaching and education, how to improve and collaborate on the research level. And that just makes it not only all the more exciting and effective for us, but again, comes back to providing the best possible care for the patients, which again is evident by the outcomes and the survival rates of pediatric cancer patients in Armenia.
Thank you. That's an excellent overview. So this takes me to my next question. Where are the major challenges in this space now, and how can they be addressed? What do you see as short-term solution, and what are the long-term solutions? And Georg, this question would be for you.
So I just highlighted on a paper I have in front of me some of the challenges that I do not forget any of them, because these are very important. Of course, the major one now I would mention is the finances, because to improve the field we need finances. To send our fellows abroad to get a training, we need finances. To do research, we need finances. And of course, coming to the cancer care, to get drugs and to do the diagnostics, we need finances. This finances is coming either from the government or from the foundations. Right now, the majority of the finances, I think around 90%, maybe, or 80 to 90% is coming from the foundations. I hope by the time the government will be able to make this a governmental priority. We had a recent discussion with the newly appointed minister, and she was kind of supporting this idea, and hopefully it will be solved soon. I hope so. And the other one, from the short-term challenges right now we have in Armenia, the first priority I would say about the palliative care, and soon we are solving this for the pediatric cancer part, but I use this opportunity to advocate also for the palliative care for cancer patients as a whole, because I think it's really critical for the patients, for those patients who are not able to get the care, cure, I would say, or treatment. At least they are able to not die in pain. This is a human right, and I think we should focus on this. Then, about the clinical trials, some of the experts, world-known experts in cancer, say that the best care we can provide for the cancer, it's the care through the clinical trials, because every time we try to do more when we implement research and with clinical trials. Right now we don't have clinical trials, although with the support from some of our friends, some of the colleagues, I should mention here also a Janus led by Dr. Garo Arman. We tried to start clinical trials. Hopefully it will be also come soon. Then we don't have a family house. in Armenia. So people coming from the marges, they are from the regions, from rural areas. Many patients do not have a place to stay. So hopefully will be able to solve this problem also. Then the nursing care, we need more training for nurses. I should put this upper list because nursing care is critical for pediatric oncology. I would say it's the most critical for pediatric cancer care. And we don't have a survivorship clinic yet, although we outlined the project and we're working right now with some of the experts in survivorship from abroad to set up the first survivorship clinic in Armenia. And also we are planning to have a separate clinic for young adults, because this is, I mean, there are distinct features for this group of patients, and it's there is an evidence that if we prioritize them in a separate group, then the outcomes will be much better. And when I'm talking about long-term goals, of course, this will come also to the short-term goals. Training, education is the number one always. So we need to have more training, we need to have more education, and in long-term goals also, we need to put a huge stress on research. We need to have research institutions, we need to have our doctors doing basic research, translational research, clinical research. This way we'll be able to become a part of global community, more important part of global oncology community. And this way, by doing research and by integrating research clinical care, we'll be able to become, I hope, and I think it will be realistic in several years, we'll be able to become a regional hub for our profession. And yeah, I forgot to mention also allogeneic transplant, and we have a program with this, and hopefully in summer we'll be able to start this. Of course, I'm talking mostly about the pediatric oncology part involving chemotherapy, but there is a huge part of surgery, of radiotherapy. Here also we need some equipment, and we need more training and research. We have talented physicians, talented surgeons, and talented radiation oncologists, and talented people on the diagnostic part, radiologists, I mean. But here we need some resources as well.
Thank you. Thank you for a nice summary. My next question would be related to challenges. And Shant, what do you think, from a diaspora perspective, what do you think can be done to address the current challenges? And what do you see as meaningful ways of diaspora Armenia collaboration in pediatric oncology sector?
Thanks for calling me Shant and not bothering with that long last name of mine. So two things. I think this is something I try to highlight every time there's a presentation like this, or we're trying to answer this question. Number one, that question should not be limited to people who are doctors or pediatricians or pediatric oncologists. I think there's sometimes a misconception that only doctors or nurses can help with improving the situation within a certain sector of healthcare, and that's not the case. And so the first thing I would say is that no matter what anyone's background is, if this is something that you have an interest in or would like to be involved with, there's almost always room for us to collaborate, for us to learn from people, even outside of medicine. There is, when we talk about developing these various components that help improve the healthcare, there is a need for people with sociology background, finance background, business background, even public policy background, as we help to write some of the legislation that'll then help to improve the care of these children. And so I think the first step is to identify or recognize whether one has an interest and would like to be part of a team to help improve, in this case, pediatric oncology, and not feel or shy away because they don't have that particular specialization in pediatric oncology, because all of us have something to contribute. And then the next step is to reach out and send an email either to City of Smile or to Geborg or myself on the clinical side, or anyone, to make those relationships and say, hey, this is what I do, this is my background, you know, how and where can we be a part of this? Of course, for us clinicians, there's the obvious stuff for us to do, which is to participate in the clinical care, to participate in the multidisciplinary teams, the teaching, establishing of relationships with our home institutions, wherever they are outside of Armenia, and etc. And then of course, you know, we can't talk about pediatric oncology. Actually, we can't talk about pediatric oncology anywhere, including, you know, where I practice in Los Angeles at UCLA, without talking about the need to finance the care of and the expenses related to taking care of these patients. And there's nothing to be, you know, this is the elephant in the room, but there's nothing to be sort of ashamed about or to hide. Even in the wealthiest of countries, this is a field that is heavily supported by charitable causes and by fundraising, and that's just how it works. We, as society, recognize the importance and the significance of taking care of children who are otherwise susceptible, who are otherwise have a full life ahead of themselves, and we recognize that that's an investment not only in those children but in society, because these are the patients that will then be meaningful contributors to society later on in life. And so I think that while I am a huge fan of sort of developing mechanisms so that any healthcare system, and particularly Armenia's healthcare system, will ultimately become sustainable in and of itself, I recognize that oncology, and in particularly pediatric oncology, is one of those fields that will almost certainly always need some sort of support so that it could continue to deliver the necessary care to the children. So the bottom line is that the financial support is needed, is going to be needed, is needed everywhere, and it's something that, you know, all of us should try to keep in mind and help support as best as we can.
Thank you, Shant. This leads me to the next topic of our discussion, and I would like to focus the next set of discussions around City of Smile Foundation. Esther, would you mind telling us what role the foundation plays in the cancer sector in Armenia? What services do you provide? How many patients do you see a year? And how many beneficiaries in total do you have?
Yes, hi Elena again, and it's very nice to be part of this conversation here today. City of Smile, as Dr. Tamamian or Professor Tamamian also mentioned, today has one of the leading roles in funding the treatment costs. And that is, of course, number one priority for City of Smile, because when we are to decide where to spend the money, the first priority for us, of course, is making sure that not a single child is left without needed treatment. And it's no secret for anyone, the socioeconomical situation in the country. So obviously it is very understandable for the vastest majority of the population here that treatment is not affordable, even if they try to sell their homes and everything they own. So without the help of foundation, that treatment would be absolutely impossible. However, just like Professor Tamamian mentioned and Dr. Shaherdimian mentioned, if there is available drugs and if there is available proper diagnosis, the chances of survival, the rates of survival can be very high. So we have to make sure that we do provide that chance to all those children, to make sure that they are given the opportunity to survive this challenge, despite the fact whether his or her parents can afford it. And in case of Armenia, it would be in most cases they can't afford it. But of course, the foundation cannot focus only on that, although that's our priority. But the foundation tries to cover as much as possible the services needed in that area. That is providing the psychosocial services to the families to make sure they go through that not easy path with support and with help from professionals. That is, of course, we try to make sure that families are also taken care in an aspect that all the kids are provided food while they're in the hospital. And given the fact that 70% of the kids come from outside of Yerevan, so that's Artsakh, that's regions of Armenia and even Javakh, it will be very difficult for the families to deliver food. And it is very important that we make sure that they are, they get nutritious, balanced food, and it's not old or it's not, it didn't go bad because it's of the distances. So we provide fresh 4 times a day meals that are cooked right on place. Of course, the foundation pays a huge attention to the research programs or capacity building for doctors, nurses, and medical staff as much as we can, because that is also very important. And as you could have heard from Professor Tamamian, that we have no lack of human capabilities, and they're all willing to learn. They all have the capabilities to learn and to grow and to go with the time. So they just need to be given those opportunities, especially the younger generations. They're, I think, on the run to get it, to capture it, everything they can, and bring it back to their home country. And just like we heard both from Dr. Tamamian and Dr. Shahirdimian, that pediatric oncology and hematology are probably the best developed areas of pediatric or in general, the medical field in Armenia. So that is very, very inspiring, especially when you're working as a foundation and you know that the efforts that are made for, have their impact and have their results. So as for the statistics, in about 2.5 years, the foundation has helped over 400 kids. And we provided around 700 million drams in assistance, which is about $1.5 million. Just in 2020, we had 105 new beneficiaries, along with the ones that came from 2019. So of course, it's no secret that it's not a 1 month treatment. So obviously there are also kids that came from 2019 and 18 and still continue their treatment. And we provided about 363 million drams in assistance, which is somewhere about $650,000. We are focusing on, just like, again, Dr. Tamamian mentioned, we're focusing and we will be hopefully very soon opening the palliative care department, which was a very big dream of ours from the very day we started. And we've been working on this with St. Jude. They've been providing us technical advice on this. And we've been, of course, COVID and all the troubles that we had in 2020 had their impact on all the delays. But nevertheless, we're going through the paths and hopefully we will be able to open it very, very soon.
Thank you. That's great to know, and that's very encouraging. You've alluded to the current situation and socioeconomic post-war pandemic crisis in Armenia currently. How does that affect the foundation's activities? And what are your main challenges currently? Go ahead.
Well, I think obviously 2020 affected everyone. I don't think any country in the world or any charitable organization in the world has not been affected by 2020. Unfortunately, in Armenia, it was even more than just COVID and the impacts of COVID. Unfortunately, we had war, which naturally directed everybody's attention to one main problem, that is preservance of our nationality, and which is normal and acceptable. That's how it should have been, obviously. But again, that leads to the fact that certain foundations which had more specific roles have been left behind in a certain way, because of course we all forget about those smaller groups of people that need our help because we had a huge national cause to be helping with. And that had its impact on the inflows of the foundation as well. So from one side, it's a financial decrease for companies, for bigger organizations, and from the other side, it's the war where we all needed everybody's help. I have to mention with some happiness, if you want to say it, that we do see some donors coming back or adding up again, which is very nice and which is very exciting for us to see that people are coming back to realizing again that there are many other problems that we need to focus on. Of course, we still have the aftermath of the war and we still have to work on that, but yet we can't leave children with cancer wait, because we all understand that the time matters in this case, and having them wait until we solve our problems will definitely not be the best solution in this case. And once again, in case we know, I mean, we all understand that if funding is available, chances are very high that a child will be cured and treated and will go home. So it is very important to make sure that we ensure the availability of those funds for the kids to receive their drugs, to receive their diagnostics, and obviously they're being treated by doctors who constantly work on themselves and get their advices on anything they don't know. So basically, in many cases, which are more difficult, doctors consult with their colleagues from top hospitals of the world. So when it comes to knowledge, they have no problem with that. They have no deficiency in that. So we just have to ensure that doctors can have the availability of the drugs they need to make sure that what they want, how they want to treat the child, or how they need to treat the child is available.
Thank you. Thank you for all your dedication, hard work, and for making cancer care possible in Armenia. And we all really appreciate your efforts. You know, as an achievement here, we have Gohar, the beneficiary of City of Smile Foundation, here with us. So happy that she could join us. Gohar, tell us about your experience, both with the foundation, also what was it like to be a cancer patient and to go through that challenge? Obviously, this must have been extremely hard, and how the foundation was able to help you in this.
Okay. Hello, everyone. First of all, thank you for having me here and giving me the chance to share my experience. So, first of all, I want to thank City of Smiles because they do a great job, like helping us with finance, helping us to find the drugs easily and without like any efforts, and making us to save time. About my experience, it was kind of exciting for me, to be honest. Like I looked at it as a problem that I should solve, not like panicking or whatever. And it made me like realize that we should like live the moment and like enjoy the life fullest. And it also like made me love myself more and like not waste my time, and understand that like we should live productively. And I guess that's it.
Thank you. That's really inspiring. What are your plans for the future? I know you're a student at AUA now. Great job.
Yeah, and if you like let me, I want to share this experience. It was like during my first chemo when I received the letter of acceptance. I was, oh my God, I couldn't believe that is true. I read the letter like thrice and then like called to AUA saying, is this true, or this is a mistake or whatever. They said, no, you're admitted. And I was like, oh my God, this is one of the like best things that could have happened. So my plans. First of all, I want to be an ambassador, firstly, work here at the Chinese embassy, and then like go abroad, work in in Armenia's embassy of China, in China. And the second one that actually I like got this feeling and decided to do this is to open to start a charitable foundation, but including not only the children, but also adults, because there are a lot of like great people, brilliant people who just can't afford the treatments. And they should be treated because like they can be the change that the world needs. And I hope that I will achieve that goal. And if not, and who is listening now, like you can go ahead and start it. We can like cooperate, because like as many charitable foundations we have, that would be like good and very good, I guess. So maybe that's it.
Thank you. And what will your message be to a child who has cancer and is going through a similar challenge now? What would you tell them?
I would tell that like you shouldn't give in. You should like keep on fighting and consider it to be a problem that you should solve. Stay positive as much as possible, because that's one of the coping mechanisms that you can have. And like always move forward. When you're on the top of mountain, start flying. So that's it, I guess. And one more thing, like you are always like more powerful than you think. You always have that strength. Remember that you are more than Superman, and like everything will be possible for you. Thank you.
Thank you, Gohar. That's really inspiring, and I look forward to seeing you fly. I think you're getting to the top of the mountain. I wish you best of luck. Thank you all again for your time this afternoon. It's really encouraging to see so much being done by the doctors, by City of Smile Foundation, to help children with cancer in Armenia. And please remember, even if small, your contributions have a big impact for every patient, as well as for cancer field as a whole in Armenia. And don't forget to donate in the link that's provided under the comments. For tax-deductible donations, you can go to City of Smile USA website. Your contributions are much appreciated, and they will have a big impact. Thank you all. With this, I thank our panel for a great discussion, and I look forward to working with you all. And don't hesitate to reach out if you feel you can contribute in any way. We'll always be happy to have a meeting and discuss your ideas.
Thank you. Thank you very much.
Thank you. Bye.
Thank you.